Live after a very busy weekend. We had a wonderful hibachi Mother's Day dinner last night with Michelle and our family, and hope you had a great Mother's Day weekend. Honoring all the mothers and grandmothers, etc. And of course, it's important to also take care of them. It's amazing how many people contacted me last week, right up through the weekend, to take care of their mother, their wife, or their own physical mother, men and women. Problems like osteoporosis, dementia, frailness, difficulty with worry about falls, all kinds of health problems. And so we might as well follow up on a lot of those questions with just a few things. Like one of the first things we worry about mothers is, number one, weak bones, and number two, weak minds. Weak bones, let's talk about bone generator, full vitamin K2, MyCell D3. We both have the soft gels, 5,000 units, and the liquid, highest quality you can get. The bone generator is BSE-free, perfect bone crystals, which is the only way to absorb minerals for your bones. And, of course, you want the MyCell D3, Myco D2 as well for your bones. So let's talk about these for a minute, and then we'll talk about weak minds for you to help your mom so that she maintains memory of all of her children and grandchildren throughout the decades to come.
Yeah, I really like the bone generator. Like you had mentioned before, the main ingredient in that is called microcrystalline hydroxyapatite concentrate. What that is the whole bone complex from veal bone. So it's not from old cow where they can accumulate a lot of toxins and heavy metals into their bones. This is actually from veal. It's cold processed, so that doesn't denature any of the growth factors that are found in live bone. Things like type 1 and type 2 collagen, growth factors. Bone is not just calcium, though calcium is a component of bone, but you also have in there a whole broad spectrum of minerals and trace minerals. So the microcrystalline hydroxyapatite concentrate, or MCHC, is the most complete nourishment for the body, for bones, in the history of mankind. So it's the best source, the cleanest source. The studies show that this is much more effective, MCHC, than just calcium alone at helping to support bone health. What do you say to that?
Yeah, it really is. And that's why when we hear people say, my doctor wants to give me bisphosphonate or the injectable drugs for bone density, they make more dense bones that are fragile and actually fracture easier because they don't increase the ground substance. And when you want to bring calcium into your body, you don't want to end up calcifying your artery walls or your solid organs. So everything that the conventional doctors do without the knowledge of functional medicine is dangerous to your health. And if you take a bisphosphonate, don't the drugs, they just stimulate osteoblastic activity and not osteoclastic activity, so it doesn't help remodel the bone. It just kind of junks it on there, and that's, as a result, causes exactly. It's not properly remodeled, and 42% of the dry weight of your bone is collagen. So if you don't generate the signals to actually generate the ground substance and we call the rebar in the bone, and the bone is basically 2 molecules of calcium for every 1 molecule of magnesium, and it requires 7 water molecules, and you need silica, boron, and manganese, and all those trace elements are present in the bone generator. I tell people any other form is just stupid. Okay, so if your doctors are giving anything else, or your nurses or your pharmacies, they're just stupid, and they're putting you in danger of calcifying organs. Then you want to make sure you have adequate D levels, and I recommend also D2, which is Myco D2. You want to have minoquinone 7, which is very important for your osteoblasts to lay down bone and for the remodeling of the bone as well. And the osteocalcin and these other enzymes or hormones that are necessary require these trace elements, or they're just not going to be present. Now you also want to compress the bones, and you can stimulate it externally. I've compressed the bones with VibraSlim and stimulated externally with Lumen Photon, Nico setting, and the MicroPulse, and you can adjust the setting from weak to a very strong signal. MicroPulse, now we have a special with the code Dr. Deagle at under $400. The Lumen is about $1,000 plus, but they're fantastic machines for your bones. So those are the ways that I approach making mama not have a broken hip or a compression fracture of her vertebrae. VibraSlim and these technologies, but you have to have the right substance in your body. If you don't have our NutriMeds, you're really cutting your mama short. So don't do it, and same for yourself.
Next is weak minds. We don't want mama to either get cataracts, so let's talk about cataracts and minds. Firstly, eyes, vision care, and Can-C eye drops. And I like the Neurogen to protect the retina, the back of the eye. Neurogen is very important to protect the back of the eye. And cell detox, glutathione, NUTRIMEDICAL, or Regenerex, the free radicals, because the eye is the most metabolically active tissue in your body. It's 10 times more active than your brain. Your brain actually, although it's only 1/25 of your body mass, it consumes 1/3 of your body's oxygen. So what you should understand that the oxidative stress in your eye is very high. So if you don't have oxidative protection, you're going to get cataracts and retinal damage. Interesting, hey?
It is, yeah. What about Vision Max? Would you recommend that?
Vision Max, yes. Let's talk about Vision Max. It's very important. And, of course, we also use it, believe it or not. We could call it Vision Max Prostate Max, but it would confuse people with which end do I use it for. So the fact is that it's interesting. The same molecules that will protect male prostate work also to protect the eye, which is, I think,
Why is that?
This is my suspicion. The prostate is actually at the bottom and almost like the drain of the urinary tract system. So it's going to concentrate biotoxins. It's going to be under high free radical stress too. So some of the same biomolecules will protect you against oxidative stress and detoxify will work in the eye as well as the prostate. That's why it concentrates biotoxins and heavy metals, and why there's a high risk in males of a chance of literally more than 1 in 2 of getting cancer by the 7th decade. So if you live 70 years old, you got a 1 in 2 chance or less that you're going to get prostate cancer if you're a male. Unless you follow Dr. Deagle's regimen and you take our nutraceuticals, then your chances disappear. You take, for prostate, this is for your father, because Father's Day is coming up too. Vision Max, believe it or not, Prostate Max, we should call it. We could relabel it, call it Prostate Max too, but it's the same. And you want to take the prostate flow to improve the flow of the benign prostatic hypertrophy. The Vision Max will actually help to stop prostate cancer. Xenoestrogen detox, and then of course the hormone synergy that stops the conversion of male hormone to female hormone, and for protecting the prostate gland from cancer is NutriDefense, because the anhydrous catechins, they did research in Japan and they found out with the anhydrous catechin that not one man in 20 years or many thousands got prostate cancer, not one. So the anhydrous catechin is the most powerful antioxidant we have. Next is goji berry and NutriComplete, and the Omega Supreme Krill. Those are amazing, but the most powerful of all is the polyphenol in our defense, which will stop prostate and other cancers.
Well, I'd also add on the malignant block.
Yes, malignant block and ellagic acid are also good for small vessel healing and repair, and for repair of the prostate gland, which is constantly under heavy metal and biotoxin damage. Which is why, because it's like at the bottom of the drain of your urinary tract system, it's much more likely to get in trouble. The other thing for mama, of course, is cognition. We're talking about Cognition Plus and brain power and Neurogen, that big trio. In fact, I had a question and a consult just before the show started. So let's talk about this. To keep your mama smart, and you want to keep her smart, so she remembers everybody's names at all the parties, remembers all her grandchildren, is Cognition Plus, Neurogen, and Brain Power. Let's talk about those three.
Yeah, the Cognition Plus is my favorite. It's the foundation for trying to support memory and brain function. And what's in it is you have methylated or activated B6, folic acid, and B12. So it's not the cheap forms. It's actually the body-ready forms, so you'll actually feel the difference with these. Also, there's some studies that are done on folic acid and B12, and very interesting, it was given to people that had mild to moderate depression, and 60% of those that took B12 and folic acid came out of their psychiatric state within a month. So fascinating.
Exactly,
well,
yeah.
I hear the bumper coming.
Yeah. But BioLVR is the start one because it has the activated B6, B12, and folate, but then we bump up to superfolate, pyromethyl B12, and cymethyl. You can't be depressed if your methylation pathway. And welcome back. And so let's talk more about some other interesting consults I had over the weekend, and I had a lot. I mean, people don't realize just how many emails and consults and calls and Skype messages I do to doctors and patients all over the planet every day. Had an interesting young gentleman living in New York City and in the Bronx, and actually in Brooklyn, I mean. And he had a problem with sexual neurological dysfunction. And there's various types of that. There's premature ejaculation. There's all kinds of other things. First thing is that related to neurological dysfunction, we recommend Brain Mag and Calm Mind, Posinol to calm the nervous system, and Spilkes, BioLVR to normalize neurotransmitters, and Cognition Plus. It's a big problem. And then, of course, he had a friend who had cancer. We recommend a full cancer protocol. And just to run through this so people can kind of get an idea, my approach to cancer, and I just had quite a bit of time talking to one of our really good supporters of NutriMeds, and regular order, and I would have called a customer patient, if you want to call online patient worldwide. And a lot of people, they refer to us first before they kind of trust their doctor, which is smart. It's like having an attorney when you go to an attorney in your back pocket that knows what your attorney's supposed to do, or your doctor. And his wife had breast cancer, and she had clean margins when they removed the lump and then the tumor, but yet they were going to do radiotherapy. And I have to say this categorically. I've done cancer chemotherapy as far long ago as 1977 at the Vancouver General Hospital, which is the second largest hospital complex on the planet outside the Karolinska in Sweden. Larger than any hospital complex in the U.S., including UCLA. And I can tell you, there's no doubt that giving radiation therapy is crazy. And that includes proton therapy. So I tell people, under no circumstances use radiation. My best approach to cancer is, number one, I'm going to research and post it up. There are several clinics in Mexico, particularly in Tijuana, that to combine hyperthermia therapies, vaccines against the cancer, and one of my favorites is what's called granulocyte therapy, where in the animal studies here done in America at universities, they had 100% survival with just giving granulocytes, which are a particular white cell taken out of younger animals and given to the older animal with the cancer. But you need all our NutriMeds, and the first one I'm going to recommend is Malignant Arrest, which shuts off the sugar metabolism of the cancer so it loses its energy source. Malignant Block, which is our sulforaphane glycosinolate, to help to repair the DNA or make the cell commit apoptosis or programmed cell death. So if it get repaired, it makes it kill itself or commit cell harikari. And ellagic acid, which does it for a different mechanism. And we use high-dose Power C and full vitamin K2 to really push the apoptosis envelope. Because really cancer is a lack of apoptosis of cells that are damaged. And these damaged cells, instead of committing suicide or the body getting rid of them, they immortalize themselves by lengthening their telomeres, by stopping cellular communications, getting rid of tight junctions, etc. So we want to strip off the capsule of the tumor with Inflamex. We want to stimulate normalization of the cellular function with cell defense, anti-inflammatory. We want to repair the DNA with ellagic acid and Malignant Block. And we want to repair the phospholipids with Nutrifos, Neurogen, and omega fatty acids, Omega Supreme, which is very important to anti-cancer, and Omega Supreme Krill, which is a very powerful astaxanthin antioxidant that helps protect. We want to stop free radicals because free radicals actually push the cancer cells to behave more crazily. So Cell Detox, Glutathione, Regenerex, and Nutritrala. So that just gives a kind of a basic idea. The vitamin D levels are very important, vitamin D3 and vitamin D2, which is our myco D2. So let's talk about a couple of these. Basically for all cancers, you need our whole cancer protocol. Then I would recommend granulocyte therapy. If you do chemo, it has to be gene-based chemo at very low dosages, or even non-chemo type drugs that'll switch the genes on and off. And there are clinics besides the Brzezinski Clinic in Houston, which is expensive, but it does help. Some tumors, for example, in children that have 100% fatality in 6 months, they have 40% survival. So I know if you Google, you're going to find some negative comments. It's because it's not a miracle. He doesn't heal everybody. But if you have something that goes from 100% death at 6 months to 40% survival, that's pretty darn amazing. And no other therapy can do that for many of the cancers that they treat. And they usually only will treat what we call terminal stage 4 cancer. They're not talking about early cancers. So Brzezinski Clinic is good. There are other, but it's expensive. And the clinics in Mexico are a fraction of the cost that will also do gene-based treatment for off-label use of chemo and non-chemo drugs to switch the genes back. So let's talk about some of our anti-cancer nutraceuticals, because Mama might get cancer, and we don't want her to get it, so we want to give her, at least for prevention, ellagic acid, malignant block, Power C, and full vitamin K2. And we want to boost her immune system with NutriDefense to fight it. Along with NutriImmune, our immune booster, and NutriDefense, these are really going to boost her immune system. So let's talk about these for a moment, Clay, because I think people should understand cancer doesn't just happen. It's because of neglect it happens. And it's not a mutant cell, it's a survivor cell that's been stressed. It's like a super prepper. It's like a Delta Force level 5 that's been brought back to America, and the government starts to aggravate him, but it turns out this prepper cell's also a billionaire. So he develops and he's a super scientist. He can develop any kind of technology he wants, and he has the money and resources. So the more you aggravate him, the more he becomes impervious to anything you do, and he decides to really go crazy. That's what a cancer cell is. It's not a weak cell, it's a super strong cell. It's not a cell that's mutant, it's a cell that's adaptive. Adaptive in a very terrible way. So, Clay, let's talk about some of these nutraceuticals.
Well, I really like the xenoestrogen detox from Mom.
Yeah.
Because all the different foods we're eating have xenoestrogens or alien-type estrogens in them. The plastics that we're drinking or eating our foods out of, and drinking our waters out of, the water itself. So really, it's difficult to escape from all the alien-type estrogens in the environment. So it's great to have something that you can take on a daily basis that helps the body to neutralize and detoxify these xenoestrogens and really help support the body. And that's why I really like the xenoestrogen detox, because it has really everything in it that you need from the research it's shown to help get rid of toxins, things like activated folic acid, selenium, calcium deglucarate, green tea extract, alpha-lipoic acid. You have N-acetylcysteine. You have milk thistle extract, which is great for the liver. You have DIM, which is from the cruciferous vegetable family, and which is an isothiocyanate, similar to the sulforaphane. You have quercetin, which is a level 5 antioxidant. Turmeric extract, which is anti-inflammatory. Trans-resveratrol, and pterostilbene, which is a methylated form of resveratrol. You have glucoraphanin from broccoli. You have dihydroquercetin, and then black pepper extract. So really, the kitchen sink in terms of everything you need to be effective.
Yeah, that's really amazing, isn't it?
It is.
So there's no excuse for somebody getting cancer. If you want to prevent it, and if you had cancer, do not do radiation. Don't do paint by numbers chemo. Another big area is recent consult I did was for a gentleman who's trying to get off opioids. And again, this is a big problem, and I'll explain this. Your body generates opiate molecules in the opiate neuraxis, right from the thalamus right down, and the lateral temporal cortex of your brain, right down to the fifth, to the what's called the Langerhans complex in your skin. There's actually 7 pain gates. And this will be in my book on Dr. U. By the way, there'll be things in there that are not published that other doctors, including neuroscientists, don't know, but I have researched and have proven and have patents on them, including the fact that the final gate, your most important gate, is your skin and the Langerhans complex. This gentleman has opiates because he had constant daily headaches. Now, when you take opioids, you block your production of dynorphin and beta endorphin. Dynorphin is 50,000 times stronger than any morphine compound your doctor can give you in a script. And when you knock it out, you actually are in a lot more pain, because these pain medications just kind of remove your normal pain mechanisms, and now you're really in a mess, because now you're trying to chase your doctor to get more and more pills, and also the side effects from taking that much oral narcotics. You can depress your respiratory system and have a respiratory arrest. You can actually stop breathing. So narcotics, if you go up slowly, you can take them, like, for example, Oxycontin, these other ones, or fentanyl patches. They aren't that dangerous, but they will basically make you lose your normal mechanisms to fight pain. And there are cases where if you've got a terminal pain condition because you have terminal cancer, or you've got some pain condition, 1 in 20 diabetics over 20 years will get a chronic neuropathic pain condition that makes them want to commit suicide. So, firstly, we give Brain Mag and Calm Mind, and 1 to 2 scoops each, 3 to 4 times a day. So let's talk about that. What's in Brain Mag and Calm Mind that's going to calm down the nervous system?
Well, Calm Mind I really like because it tastes great. It's easy to mix with water. Just 1 to 2 scoops is really all you need. You could sip it throughout the day. I know you have it right there on your desk there, Dr. Bill. And what's in it, you do have 2 different forms of magnesium, the dimagnesium malate.
I'm sipping it right now.
Oh, you are? Well, what do you like about it, Doc? It's one of your staples, right?
I have the Calm Mind after 7. I have the Brain Mag and the Sports EnerG-lyte during the day, which is energizing. People wonder, why is he the Energizer Bunny? Like, I was up this morning early, about 5:30, working, and after 7 o'clock, it's like, I got to start shutting down. And in order for me to get to sleep, I take triple the dosage of an average person that would otherwise be put into coma. 3 of our melatonin TR, which is 15 milligrams. A normal person, 2 or 3 milligrams, and they're going to be la-la land. I take a Rasputin level dosage in order to make me go to have a normal sleep. So.
Yeah, you like it.
I'm not exaggerating when I say that too. People that know me personally know I've got the metabolism. As I say, I'd be very hard to put down. I have to use an extra amount. If I was a rat, you'd have to use a lot of rat poison to put me down. Let's put it that way.
Yeah, you would.
In other words, I have a metabolism that's pretty darn strong. It's amazing. So I tell people, when you're having chronic daily headaches, you've got to calm the nervous system down. You also want to stop the withdrawal from the opioids, and we use Positone. We use Cognition Plus, which helps normalize brain and brain power, oxidative stress and brain power, and cell detox glutathione. We use NutriDefense to react as an antioxidant, and we want to get rid of stealth pathogens that are often present too, that are a factor, like allicin med, nutriodine, and so on. And particularly for the brain and for the central nervous system, Omega Supreme Krill. Krill astaxanthin is very, very good, as well as Neurogen for helping to stop neuropathy, along with the use of Nutrifos Neurogen combination and Omega Supreme Krill is very, very particularly good at helping neuropathy. We want to use, of course, with the chronic daily headaches, Inflamex and Cell Defense, which is the curcumin long slow release system. So let's talk about a couple of these, like Inflamex and Cell Defense. We don't want to use non-steroidals ever. In fact, if I never saw anybody ever take a non-steroidal again, I'd be happy. It wrecks your stomach, it can cause heart attacks, and it can cross your blood-brain barrier and screw up your brain. And it really, all it does is actually makes you not feel pain because it blocks things like substance P, but it actually completely destroys your ability to generate new collagen, elastin, and the hyaluronic acid polymer in your joints. So you rip your joints apart, but it doesn't hurt as much until your joints are totally screwed up, and then you require knee replacement. So whether it's over the counter or your pharmacist giving it to your doctor, don't take non-steroidals. Take Inflamex.
Well, not to mention
take Cell Defense for inflaming organs.
Adverse drug reactions with NSAIDs were caused 16,500 deaths a year.
Oh, it's much more than that. I'm sure that the doctor and pharmacy and just over-the-counter induced NSAID deaths are probably approaching 1 million. I mean, in this country, it's just crazy. And here's a list of things. Suicide, because it can cause depression. We're working down the head. Organic brain dysfunction, make you drool permanently. Firstly, to knock out your immune system so you get periodontal disease and tooth problems, heart attacks, great stuff. In fact, they proved that Celebrex, and this is with the product release, that before they put the warning on the bottle, a black box warning, it caused over 50,000 deaths from cardiac arrests just in 1 year alone. 50,000 just from Celebrex.
Wow.
So, it's related to all the other non-steroidal anti-inflammatories. So when I hear people with chronic daily headache, the cause of headaches are, do you have a TMJ dysfunction? Do you have an occipital neuritis? Do you have a problem with inflammation of the dural nerve sleeves of your dura mater of your brain? We can address every one of those, diagnose them, and settle it down. And you can map those specific nerves using an Axon 2 scan, which I helped develop with Dr. Jim Hedgecock. He had the technology. I added potentiometry, which is EMG, back in the year 2000, 1999, 2000. And it's the only objective way of mapping pain out in the world is the Axon 2 nerve scan. It's more accurate than a EMG NCV, nerve conduction study done by a neurologist, at mapping out pain. There's nothing comparable to it. The other thing you can use that with is use a gold electrode with electrolyte, and you have a threshold test that measures in microvolts the current necessary to produce a threshold response of an electromyographic twitch at electrode set at the base of the skull. And no matter where it is along the axial spine or periphery, those EMG firing will determine if you reach threshold in terms of a nerve stimulus anywhere in the body. Interesting, eh?
Yeah.
Yeah. In other words, I've got a neurological theory of pain that's completely different from what doctors are preaching out there, and I'll be putting it in my book, Dr. U, and when people see that, it'll be also the basis of further scientific validation that the current and past approaches for treatment of pain are completely wrong-headed. Which is why I tell people if you ever start taking narcotics, you're kind of screwed because you're knocking out your natural mechanisms. But there are times when someone's dying of cancer and is riddling every bone in their body, and they're not going to do chemo or other things like I recommend, natural therapies. Or they've got some horrible neuropathic pain condition, they've let it go for years, and they've been treated by, knucklehead doctors. They're going to do the wrong thing and wait till this condition gets so far gone the patient's suicidal. They're going to be in trouble. And as I say, you're not going to hear this straight up info on any other show on this network or any other radio or television show on the planet. I'm going to tell you the straight up trade secrets, the ugly facts, as I say, and also the solutions. And we have solutions. As I say, we can help to diagnose chronic daily headache. There's no need for you to suffer because you need an anatomic and neuropathological diagnosis. You need to reactivate your normal opiate mechanisms so your body's own brain and nervous system can control the pain, which is always what I call an informational condition. People don't realize it's an informational neurological condition where muscle firing patterns and what's called the eccentric and centric muscle firing patterns neurologically are out of balance. For example, around the axial spine, you'll see a phase shift in the muscle contraction, so ordinarily muscles are out of balance by 180 degrees on rotational, torsional forces in the spine. If it's less than that, you're going to have pain. And you can actually map it out. We did that with my research with Dr. Stu Donaldson back in the early 80s at the University of Calgary. So, by the way, none of this is published. You won't find it on Google or anywhere else. You will here. And welcome back, and another interesting condition. I get some really neat protocols I'm going to be posting up. I had a gentleman with very nasty temporal arteritis. Now, if you don't know how bad temporal arteritis can get, if you're listening and you have a relative, it's where the temporal arteries become extremely inflamed, but there's also arteries to the brain, and there's a very high risk of getting a clot or a thrombotic activity occurring in a brain artery. You could have a massive stroke and lose a good chunk of your cortex or your deep brain nuclei. A very bad thing. So the conventional doctors are going to set up intravenous, they're going to give you steroids, they'll try to give you disease-modifying drugs, they maybe give you a PICC line with antibiotics to cover not only those problems, but if you have a bleed, you can get aseptic meningitis where the blood and the iron and the hemoglobin can cause your brain to get inflamed or swell. Nasty. And of course, a gentleman unfortunately went through all these conventional treatments and it didn't work too darn good at all. So he called me in panic saying, please help me, doctor, help me. And I said, of course I'll help. We want to turn off the inflammation with cell defense, which is our curcumin product. You want to reduce the clotting because these people are very high risk for getting a clot or an embolus, so they want to be a nattokinase. And we may add lumbrokinase as well, but we need to be a NutriDefense as an antioxidant, Neurogen, ellagic acid, malignant block to prepare the DNA and to stop the damage to the blood vessel wall, Omega Supreme Krill, and Neurogen. Docosahexaenoic acid is very good for preventing damage to blood vessel walls, so Neurogen and Omega Supreme Krill, and of course Cognition Plus and Brain Power. So let's talk about some of these, like for stopping clots, nattokinase. If you're trying to prevent heart disease and you want to reduce the C-reactive protein if it's elevated, or Pi1, which is a more accurate marker, plasminogen activator inhibitor 1, you want nattokinase. And you may bump it up to lumbrokinase, but nattokinase should be a standard. I take it every day. And you can actually do a rheologic test for blood viscosity. It'll determine which is a better marker of inflammation, is to look at your rheologically non-Newtonian fluid dynamic blood viscosity. I call it, is your blood corn syrup or is it water? If it's corn syrup, you're in trouble. capital T trouble, and that's why temporal arteritis is hyperviscous blood with increased rheologic factors that cause your blood to be viscous because of antibodies in your blood making the sticky cells stick together, increased levels of proteins like fibrin, increased levels of inflammatory markers such as tumor necrosis factor or IFN gamma, TNF alpha, etc., all kinds of other ones, IL-1 beta, that can cause increased blood viscosity. And of course, the activation of soluble ICAM 1 and 2, and all these other fancy markers as I spin out these terms, but let's put it this way, A to Z I know how the system works in terms of what causes people to get temporal arteritis. And you have to turn off that autoimmune, that disease, because to some extent there's a stealth pathogen present as well. So we want to use allicin, MAD, Nutridyne, and silverwire inflammation. So let's start off with cell defense. If there's one nutraceutical that I consider the most powerful and important, it's curcumin. But it's not very well absorbed. And when you use our cell defense, it's the only absorbed, slow-release, highly absorbed technology available, and then, of course, their topical curcumin cream. So let's talk about this for a minute, because cell defense is really important if you want to reduce brain inflammation. Whether it's arteritis or Alzheimer's disease, where you've got S100 protein aggregates and neurofibrillar tangles, or you've got autism, it's basically various variants on what I call BOF, or brain on fire. Here your arteries are on fire, and you're soon going to have a stroke because you're going to clot off an artery, throw an embolus. So let's talk about cell defense for a minute.
Sure. Well, it is the most bioavailable form of turmeric available, and it is a standardized extract of 95% curcuminoids, which is the business end of the turmeric in terms of inflammation-fighting skill. And then you have in the black pepper extract, which helps with the absorbability of the turmeric. It's in a control-release tablet, so it bathes the cells in an anti-inflammatory turmeric through the course of 4 to 5 hours. You know, when you look at the studies, big studies of populations, you look at countries like India, and you look at their health challenges, they never have issues with Alzheimer's disease. And one of the reasons they postulate is because of the high amount of turmeric in their foods. Do you have anything to say to that, Doc?
Exactly. Yeah, they have an average intake in their diet of about 68 milligrams per average Indian of turmeric. Now, one of these tablets will deliver 350 milligrams, so it's quite a bit higher. So if you're trying to reduce what we call BOF, or brain on fire, inflamed arteries, or the epigenetic changes that are going to turn on, make cancer cells develop, because a cancer is just a stress cell. Cancer is not a mutant cell. Mutations make cells die because it destroys their genetics, so they can't create enzymes and structural proteins, so they just die. So if you get hit with a cosmic ray, cell's not going to turn cancer. It gets turn cancer if it's exposed to enough radiation to cause it to be aggravated but not dead. And the cell adapts to that stress by turning on and off genes and say, okay, you ticked me off, I'm Delta Force, I'm a billionaire, I'm going to get you now. I'm a prepper, super prepper up, star, 7-star prepper. You want to bother me, government? Now you're going to have a bad day. That's what cancer is. Cancer is not a weak cell, it's a strong cell surviving a lot of aggravation. People have the opposite view. They have this view, oh, it's a weak cell, it's mutant, it's lost its way. No, it's not. It's an aggravated cell that's saying, you're trying to poison me, you try to kill me, I'm going to immortalize myself, stop cellular communication with other cells, I'm going to make certain that you can't even find me because I'm going to cover myself with a fibronectin capsule. Forget it. If the immune cells want to find me, because they're not even going to see the activator proteins on the outside surface. So, same with temporal arteritis. You've got antibodies attacking the artery wall. You want to turn those off. We want to use high-dose power C. We want to use things like Allergon or Allerblock to stop the cytokine levels. Cell defense is the first. As I tell people, I put layer upon layer of nutraceutical until finally we kind of damp out the fire. Let's put it this way. I'm I call it an organ firefighter. Because a lot of the stuff, whenever you get a disease, including cancer, it's really inflammation of one type or another. And there's different types of inflammation. They can make cancer cells develop, or make plaque develop, or make an organ decide, well, we're not going to get rid of damaged or senescent cells, so the organ's going to get old and then become non-functional. We call that apoptosis. Interesting, hey?
Yeah.
Yeah.
Tell me about, in the past, they didn't have as many high levels of cancers in societies. Why do you think now we have such a prevalence?
Well, we have a number of reasons. I talked to this morning to a gentleman that talked about his wife had cancer of the breast. The first reason is we have biotoxins. There's 7 new biotoxins entering the troposphere every day in North America and worldwide. 7. And we're talking about parts per million or higher. So if I did a high-pressure chromatography or nuclear magnetic spectroscopy of your blood or a tissue sample of fat or packed red and white blood cells, which I've done for years, you'd see 7 new ones in the biosphere every day. Then we have GMO food, which is also genotoxically going to cause cancer, because there's promoter genes in that are actually transferred from moths into an unstable plasmid in the cells to create the gene activation of the genetically modified food. And these unstable plasmids get in your gut bacteria and in you. For example, when you get a Bacillus thuringiensis plasmid that gets in the gut bacteria of the little bee, the gut bacteria's bacteria, the little bee's bacteria in their gut, has this plasmid inside their bacterium that now generates thousands of times more Bacillus thuringiensis toxin than the regular Bt toxin bacteria. Because it's now inside their gut, it fries their little brain. Okay? Now when you put that in, you got now fluoridation, chlorination, bromination of everything, which destroys your mitochondria, which is another factor causing cancer, and causes cells to move to anaerobic metabolism, which is what cancer is. It's anaerobic. And then you have scalar radiation that entrains tissue to turn on and off genes to say, hey, genes, hey, cell, go crazy. Now you can't even communicate with each other or turn on and off the genes to actually regulate a cellular function, because that's how the cells work, is scalar physics. It's not surprising we get cancer. That's why we have things that that's why we use things like micropulse to reset your body's Schumann resonance. That's why we use lumen photon to use light therapy to reset the body. That's why we use mild hyperbaric oxygen. NutriMeds, if you're not taking the right NutriMeds, don't go elsewhere running all over the place thinking, I can second dose Dr. Deagle. I can get something better. Not. A big 20-foot high knot. Please, don't do that. Get all your wellness nutraceuticals here at Nutrimedical. If you need advice, we'll provide it. We provide increasingly better, updated wellness conditions. They're all free for our customers. And I will only charge you, and by the way, if you get a membership, it's only for those people who absolutely won't buy any product. They have to have a membership to get to the wellness conditions. If you are a customer, you've got the wellness condition and the live stream activation free. We pay for it. So stick with us.